A warm welcome, my dear students, in our health class. To formally start our discussion, first, let us identify the following. Content standard. Performance standard. And most essential learning competencies. To jumpstart, let us recall the definition of health. It is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. It is most often being related to solely the physical well-being of an individual. It is not more than looking healthy, but an individual must also be feeling, thinking, and interacting healthy to achieve wellness. For the review, let us recall the different qualities of person with good health and emotional health, with sense of well-being, ability to enjoy, participation in life, ability to deal with life stresses, and capacity to change. Sense of balance, self-care, ability to care for others, self-confidence, and good self-esteem. These are the qualities of a person with good mental and emotional health. For today's topic, I will continue the discussion about the third quarter Health 7 lessons about mental and emotional health. Mental illness. Mental illness are health conditions involving changes in emotions, thinking, or behavior, or a combination of these. Mental illnesses are associated with distress and/or problems functioning in social, work, or family activities. Mental illness refers to a wide range of mental health conditions or disorders that can affect or disrupt your mood, thinking, and behavior and impair your daily functioning. These disorders may be caused by prolonged stress and mental and emotional suffering due to various triggers. Triggers are events, conditions, or situations that may activate a person's tendency to experience symptoms of mental disorders. For the next slides, you will see some examples of common triggers. Conflicts in company or school, lack of job security, company or school or local government unit policies, unclear expectations, poor communication, the way employees are treated by their bosses or supervisors or company, co-workers or classmates, or people who do not do their fair share. Urgent deadlines. Too much work or study. Uncomfortable physical conditions. Relationship conflicts. And dealing with rude customers or people. The exact cause of mental illness is not known. Mental illness are usually caused by a combination of three factors: biological, psychological, and environmental. These are some common types of mental illness: depression or major depressive disorders, post-traumatic stress disorder, bipolar disorder, schizophrenia, panic disorder or phobias, and generalized anxiety disorder. Major depressive disorder. It is developed when depression in a form of persistent sadness, despair, and hopelessness. For the signs and symptoms of major depressive disorders are the following: slow to react, lack or loss of energy, lack or loss of motivation, lost appetite and lose weight, overthinking, and feeling alone. Generalized anxiety disorder. People with these conditions have severe fear or anxiety, which relates to certain objects or situations. For the signs and symptoms of generalized anxiety disorders: restlessness, fatigue, tense muscles, and interrupted sleeps. Schizophrenia. Person with this mental illness may experience hallucinations or feeling of being detached and away from reality. He or she may lose the functions of the sense organs and thinks differently from a normal person. For the signs and symptoms of schizophrenia: hearing voices, neglect personal hygiene, disorganized thinking or speech, have exceptional ability or fame, inappropriate or bizarre posture. Post-traumatic stress disorders. A person may have this disorder when he or she experiences a traumatic situations such as being abused, raped, or involved in an accident. Signs and symptoms of post-traumatic stress disorder: irritability, extreme sadness, being spaced out, frustrations, and avoidance to people or isolation. Bipolar disorder. It is also called manic depressive disorder. A person who experiences this disorder may at times feel very happy and elated, then at an instant may feel at most sadness and despair. For the signs and symptoms of bipolar disorder: difficulty in concentrating, difficulty in decision making, recklessness and impulsiveness, rapid speech and racing thoughts, agitations or extreme irritability. Types of phobia and/or panic disorder. There are different types of phobia like simple phobias, social phobias, and agoraphobia. Simple phobias. This might involve disproportionate fear of specific objects, scenarios, or animals. Social phobia, sometimes known as social anxiety. This is a fear of being subject to the judgment of others. Agoraphobia. This term refers to a fear of situations in which getting away may be difficult. Many people misunderstand this phobia as fear of being outside. These are the signs and symptoms of some common phobias: feeling like you are choking, trembling or shaking, feeling out of touch with reality, and chest pain or tightness in the chest. Aside from that, there are also other mental health problems that individuals may experience. These are the other mental health problems: learning problems and disorders, attention deficit hyperactivity disorder, anxiety problem and disorders, and mood problems and disorder. The following are some common learning problems and disorders. These are the different category of attention deficit activity disorder. inattention, impulsivity, hyperactivity. The following are some lists of anxiety problems and disorders. And lastly are the common examples of mood problems and disorder. Mental health treatment. It is important to remember that mental disorders are diagnosed only by professional physicians may determine the illness being experienced by an individual. Furthermore, it is needed to note that the symptoms of the disorders should be prolonged and repeated, not because a person experiences one or two of the symptoms at one time. It does not mean that the person is already diagnosed with that illness. When it comes of treatment and cure, a professional physician may decide on whether to give the patient's medication or subject him or her to routine therapy session. Here are some of the suggested mental health treatment: psychotherapy, self-help plan, peer support, medication, hospitalization, support group, and complementary and alternative medicine. Psychotherapy is the therapeutic treatment of mental illness provided by a trained mental health professional. For the post-test, enumerate the different types of mental illness. Identify the signs and symptoms of each type of mental illness, and list some mental health treatment. That is the end of my presentation. I hope you learned something about mental and emotional health. Here are the references that I've used in doing my presentation. Photos used here are from Canva. This has been your teacher for today, Mrs. Cynthia Soledad S. Aspe. Thank you for watching my video lesson. Before I end, let me share with you the title of the book that made an impact to mental health awareness. It was authored by Clifford Beers. Ring the bell of hope for mental health. Keep safe always!